Welcome to this video on oral glucose tolerance test or OGTT. This test is used to diagnose type 2 diabetes, prediabetes and gestational diabetes. In this session, we will explore the underlying principle, procedure, indications, contraindications and interpretation of OGTT findings. When is OGTT used? Diabetes is a common and chronic metabolic condition which is diagnosed by one, fasting blood glucose concentration of 7 millimole per liter or more. Second, random glucose concentration of 11.1 millimole per liter or more. Random glucose concentration is defined as glucose concentration taken randomly anytime irrespective of whether the patient has eaten or fasted. Third, by measuring glycated hemoglobin A1C concentration of 6.5% or more. However, in many cases, these three tests are inconclusive and borderline, although clinical symptoms of diabetes may be present. In such cases, OGTT is recommended to diagnose diabetes. A 2-hour value of OGTT equivalent to 11.1 or more millimole per liter is considered to be diagnostic of diabetes in such cases. Before discussing the topic further, it is important to know that OGTT values are reported in two different units. The first one is milligram per deciliter and second is millimole per liter or millimolar, same thing. These two sub units are interconvertible. For example, if you want to convert millimole per liter into milligram per deciliter, you multiply millimole per liter by a factor of 18 and you will get milligram per deciliter. Alternatively, if you want to convert milligram per deciliter into millimole per liter, you divide milligram per deciliter by a factor of 18 and you will get millimole per liter. Let us discuss indications and contraindications of OGTT. This is recommended in cases of impaired fasting glucose concentration ranging between 110 to 125 mg per deciliter. This is also recommended in gestation diabetes screening or diagnosis in cases having history of miscarriage, macrosomia, preeclampsia, diabetes and family history of gestational diabetes. This test in such cases is performed during 24 to 28 weeks of pregnancy to confirm diabetes. This is also recommended in cases where there is a discordance between the result of HbA1c and fasting plasma glucose concentration. For example, when HbA1c is high or higher and the fasting plasma glucose concentration is normal, in such cases OGTT is recommended. This is also recommended to confirm suspected cases of prediabetes and unexplained renal glycosuria. Glycosuria or glucose in the urine can also occur due to diabetes. Therefore, OGTT test is used to confirm renal glycosuria. However, it is not indicated in the confirmed cases of diabetes. For example, in cases of type 1 diabetes mellitus, this test is not used because of side effects. Let us discuss the procedure of OGTT or how the test is conducted. Blood and urine samples are collected from overnight fasted individuals. The fasting should be minimum 8 to 12 or 14 hours and that time is designated as 0 hours. The patient is then asked to ingest 75 gram of glucose solution within 5 minutes. Then the blood and urine samples are collected at 1, 2 and 3 hours post oral glucose intake. Glucose concentration is measured and a graph is plotted between the time and glucose concentration. As you can see, in the normal condition, the glucose level is normalized within 2 hours, whereas the level remains higher in type 1 and type 2 diabetes, indicating insulin deficiency and resistance. Let us discuss principle of OGTT or biochemistry of OGTT. OGTT measures how efficiently our body metabolizes glucose after glucose ingestion or glucose load. Under normal condition, the level of glucose in the blood is normalized within 2 hours of glucose load. However, in case of type 1 and type 2 diabetes, the level of glucose remain higher, indicating insulin deficiency in case of type 1 diabetes or insulin resistance in case of type 2 diabetes mellitus. OGTT is used in Suspected cases of renal glycosuria. Glycosuria is the presence of glucose in the urine, which normally occurs when blood glucose exceeds the renal threshold of 180 mg per deciliter. However, renal glycosuria occurs due to impaired renal tubular reabsorption of glucose despite a blood glucose concentration remaining below the renal threshold. In suspected cases, plasma and urine glucose levels are measured following a standard oral glucose load to confirm renal glycosuria. By analyzing glucose concentration in the urine and plasma samples, renal glycosuria can be confirmed. For example, presence of glucose in the urine when plasma glucose concentration is less than 180 mg per deciliter confirms renal glycosuria. On the other hand, presence of glucose in the urine when plasma glucose concentration is more than 180 mg per deciliter confirms diabetic glycosuria, rejecting or ruling out renal glycosuria. Let us discuss the factors affecting OGTT. There are a large number of factors which can affect this test and their interpretation. The first and foremost is the patient should undergo adequate fasting. Minimum 8 to 12 hours of fasting is required to avoid elevated baseline glucose concentration. Second, the patient should also receive adequate carbohydrate diet 3 days before the test is conducted, as low carbohydrate diet can lead to reduce or decrease glucose tolerance. Next, the time of test is also important. It must be conducted in the morning because of diurnal variation in glucose concentration. Next, the patient should not undergo physical exercise or extensive exercise during or before the test, as it will lead to increased glucose utilization. Certain hormones released from pituitary as well as thyroid glands such as cortisol, growth hormone, glucagon, and thyroid hormones can decrease glucose tolerance. Liver diseases can also impair glucose metabolism and its utilization. In addition, certain acute illnesses and stress can increase counter-regulatory hormones, leading to increased glucose concentration. Certain drugs such as steroid, diuretic, and contraceptive can also increase glucose concentration artificially. Finally, the pancreatitis can lead to decreased insulin secretion and action that might lead to decrease in glucose tolerance. So these factors must be controlled before conducting the test for an accurate and appropriate interpretation of the findings. So in summary, OGTT test measures body's ability to metabolize glucose after a glucose load. It confirms type 2 diabetes mellitus, gestational diabetes, prediabetes cases, and renal glycosuria. A 2-hourly OGTT equal to or more than 11.1 millimole per liter glucose confirms diabetes. OGTT is critical in pregnancy and borderline cases to confirm diabetes. However, it is not recommended to diagnose type 1 diabetes because this might have serious hyperglycemic effect. Let me ask a very simple question on diabetes. The question is, which organs require insulin to utilize glucose? Choice A is brain and kidneys, B is RBCs and lungs, C skeletal muscle and adipose tissue, D liver and adrenal. So the correct answer is C, skeletal muscle and adipose tissue. Thank you very much for listening to this video. Please like it, share it and subscribe it. Until next time, you take care. Bye bye.